According to the Sisonke Programme researchers, Johnson & Johnson COVID-19 vaccine offers robust protection against the Omicron variant. It's part of their latest findings. Let's talk now to Professor Glenda Gray, who is President and CEO, of the South African Medical Research Council. Professor Gray, good evening to you, and thank you so much for your time. So, of course, there's been a lot of talk about the efficacy of vaccines against Omicron, and great to see that Johnson & Johnson we now have the latest credible figures around how Johnson & Johnson has been doing.
Yes, Kathy, we provide the first world evidence that 2 doses of the J&J vaccine work against Omicron. So we saw an 85% protection against hospital admission in healthcare workers that received the boost of the J&J vaccine after receiving the first vaccine in early parts of this year. So we're very excited to show that the vaccine works against Omicron and provide the world's first evidence on this.
So just to be clear, Dr. Gray, those that you had sampled for the study, are they part of the original cohort that were the first to receive the Johnson & Johnson vaccine last year, or is this a completely new group of medical professionals?
Kathy, so we offered everybody who got the J&J jab early on in this year. So we gave the Sisonke 1 study started on around the 17th of February. And so everybody who was in that study could participate in the boost study. And around 230,000 healthcare workers participated in the boost, the J&J boost. And this J&J boost happened just before the Omicron Omicron surge. And so we were able to evaluate how good the boost did against Omicron in South Africa at this time.
There have been big questions around how long the protection by vaccines actually lasts. Is that something that that you as medical researchers are able to speak a lot more definitively on right now?
So what we saw with the J&J jab is that the second dose increased protection and maintained its stability over time. And so we saw that it got up to 85% effective. And we'll be evaluating the effectiveness over time. So we were quite happy that we maintained our effectiveness at 85%. And we did very well in terms of the boost. We also looked at the Pfizer vaccine, and we were also able to provide evidence that the Pfizer vaccine also was protected against hospital admission as well in the same kind of time period. And so we have evidence that both Pfizer and the J&J jab were able to provide protection against hospital admission in South Africa.
What does this mean now going forward? Does it mean that the people who perhaps had received 1 dose of the Johnson & Johnson vaccine will be encouraged to go for a booster shot?
Yes, I think this is encouraging data. So already we're seeing with Pfizer, people are taking their 3rd dose. And now with J&J, we provide evidence that a 2nd dose, given at least 2 months after your 1st dose, will provide protection. So I think both programs are reassuring that both Pfizer and J&J are working in South Africa and provide great protection. And so we would encourage everybody who has had the single dose of J&J to get their 2nd dose, because this vaccine is protecting, and at least we're only on 2 doses. And we will have to see what happens over the next year. So we will be evaluating and following up the healthcare workers that got the boost to see how long the 2nd boost lasts for, and whether people in the Sisonke study need an additional boost or another vaccine in the future. So it's very important. So we're very grateful for all the healthcare workers that enrolled into Sisonke, because they've provided the world's first evidence on the way J&J vaccines work, and also will provide the government a view of what to do after you've received 2 doses of the J&J vaccine.
Professor Gray, there were lots of questions, especially as South Africa was entering, the 4th wave of the COVID-19 pandemic, around breakthrough infections. Have you been able to study that issue in particular? And more often when it's raised, it's really around, the lack of trust in vaccines.
Yes, Kathy. I mean, what we did see in the Sisonke study is that we did also see the decoupling or the delinkage between cases and hospital admissions and deaths. And so whatever happens in Sisonke mimicked what we saw in the greater population. We were also able to provide evidence, as the National Vaccine Programme also provided evidence of the value of vaccination. And I'm sure you've seen the recent data coming out of the NVOH that shows that most people that are admitted either into hospital or into ICU are actually people that have not been vaccinated. So our study provides provides supporting evidence to the value of vaccination in our country.
And as we have this conversation, we're still sitting at, just around 40% of the adult population in this country that has been vaccinated. And after the fourth wave, there are many people who believe that they don't actually have to ever get vaccinated because they survived all of these waves without the vaccine. What would you say to those people?
So I think we know that people who've been exposed and got infected will have waning immunity, and that vaccination actually boosts your immune response. We also have data from South Africa that shows that if you got vaccinated and got an infection, you have better cross protection against other variants. And so whether you got a breakthrough, whether you got infected or not, there is additional value of being vaccinated, because this allows you to get cross protection against other variants that may emerge. And so even though you have had an infection, I would still encourage people to get vaccinated so that they can have better protection against future variants that may emerge. We know that people who got the J&J vaccine and who got Omicron will have beautiful cross protection against Delta, the Delta variant. And so if they were exposed to Delta in the future, that they would be protected. So it's immaterial about whether you got infected or not. Getting a vaccination will boost your immune response and will cause better and robust protection against future variants that may emerge.
Yeah, of course, the country right now breathing a collective sigh of relief that we are officially out of the fourth wave, but we know that the issue of variants is still very much up in the air, and that we could well still see the development of another variant. What is the work that you as scientists are doing when it comes to these vaccines to ensure that there is protection against whichever mutation of this virus we might see going into the future?
So, Kathy, this year will be very important. And as we go into the winter months, we expect to go into another wave, a fifth wave. And hopefully with good vaccine coverage and previous exposure to SARS-CoV-2, we hope that the fifth wave will be much less. And it's very important for scientists, for us to make sure that people who haven't been vaccinated get vaccinated, and those who need their boost get the boost, because we have to make sure that we try and limit the amount of community transmission that occurs, because we know that as long as there's transmission, there will be viral evolution. And so our job as citizens in this country and as scientists is to track transmission, to see what viruses are emerging, and to make sure that we get our doses so that we can protect ourselves in the future and limit the amount of viral evolution that happens in our country.
When it comes to those who have been vaccinated and received the booster shot, is there evidence that looks at the extent to which these individuals then also shed the virus?
So we have evidence that people who have had the vaccine and have got infection shed the virus for shorter periods of time and have a milder infection as compared to those who have not been vaccinated. We also have evidence in South Africa and abroad that people who have been vaccinated are less likely to go to hospital and less likely to have severe side effects, thereby showing that vaccination does mitigate the infection. So although you might get you might get a breakthrough infection if you've been vaccinated, the breakthrough infection is usually limited and much milder than it would have been had you received the variant without being vaccinated.
Professor Gray, just lastly, when we look at the year ahead, again, you've told us about just where, the areas of concern might be in terms of the winter periods of the month. But more broadly, what do you think are the biggest challenges that South Africa will have to deal with in its fight against COVID-19 to ensure that the impact that it has on the population is not as devastating as we've seen over the last couple of years?
Kathy, that's a great question. I think we have to keep on vaccinating people, particularly people who are younger. We see that the lowest coverage is in the younger age group, the younger adults. We need to make sure that our children get vaccinated. We've seen an increase in COVID-19 amongst children, and so making sure that children over 12 get vaccinated, and as well, when we do get permission to vaccinate children under 12, that we do that. Our job this year is to keep schools open. Our job this year is to keep our workforce able to work and being vaccinated. And our job is to try and mitigate the community transmission of SARS-CoV-2. And we can only do that if we continue to implement the non-pharmaceutical interventions, get vaccinated, and make sure that we operate in well-ventilated areas. So we have to work very hard this year to control SARS-CoV-2 in our country so that we can keep our economy open and we can continue to operate as citizens in this country, going to school, going to university, and going to our workplace.
President and CEO of the South African Medical Research Council, Professor Glenda Gray, thanks for your time tonight.